So my talk on computerized training was really just kind of an overview of research I've done as long as 10 years ago, up to some meta-analysis that we did more recently. The study I did about 10 years ago was one of the bigger independent studies of a computerized, commercially available brain training product, and one of the first ones, in my opinion, to use a really adequate control group, an active control group, where the people receiving the computerized training were sort of matched to people who engaged in cognitive activity as well, so that they might suspect that they would have some benefit from their activity as much as the people who engaged in computerized brain training. And in that study, we saw a small effect, not only on the tasks that the computer trained, processing speed kinds of tasks, but also that generalized a little bit to paper and pencil measures of what we call working memory capacity. So it had several kind of novel components. One, it was big. Two, it had an active control. And three, it showed some modest generalization to paper and pencil measures. Since then, we've been including computerized brain training in a more multi-component type of intervention. And last year, we were asked to do a meta-analysis of computerized brain training versus other types of therapist-driven cognitive interventions for people with mild cognitive impairment, not focusing on their cognitive outcomes, but rather on outcomes like daily function or self-efficacy. And again, in that meta-analysis, saw that computerized training had a small to modest effect size, even on non-cognitive outcomes in people who have mild cognitive impairment.